Today, we are joined by Dr. Stephen Carney with Baptist Health in Van Buren, discussing ways to keep yourself and your family safe during the COVID-19 pandemic as more and more businesses begin to reopen. Doctor, thanks for being with us today.
Thanks for having me, Erica.
So now the businesses are starting to reopen. We're talking about restaurants, gyms, salons, many other things. What are some of the best practices for families going out? What should we be doing? Anything above and beyond those state mandates and guidelines?
Well, everybody's, I hope, familiar with the guidelines that the governor has set forth. They've been very good as far as that is concerned. I would recommend, of course, that if you're going to be out in public anywhere, you really need to wear a mask, whether that is, the surgical type mask I have here, or the or just a homemade mask or something of that sort. Okay. It probably wouldn't be a bad idea to wear gloves. Now, if you're going to be eating and stuff, that's going to be a little bit iffy there. But if you're going out to the grocery store or something of that sort, you need to wear gloves as well. I've done that when I've gone out to Walmart or to Sam's.
Talk a little bit more about the masks. You brought that up. It's something that with these businesses that are starting to reopen, especially restaurants, gyms, salons, there are mandates from the state saying that people that work there have to wear them, and that people that are frequenting there as customers are required to wear them at least at certain points. I think the point of confusion, at least for me, is if you walk into a restaurant and you're required to wear a mask until your food comes, and then you can take off the mask. Is the mask actually doing any good if you're only wearing it for half the time you're there?
Well, the mask is doing some good as far as keeping droplets out of the air. That's the idea here. It's not a perfect solution, obviously. That's why you have to do the social distancing as well. And certainly if you're having any sort of fever or cough, that sort of thing, you do not need to be out in public anyway, okay? So it's not just the masks, it's doing the social distancing as well, and of course using good hand hygiene and doing that sort of thing too, washing your hands and being aware of that sort of thing going on.
Okay, so you're saying that in wearing a mask, even if it's only for part of the time that you're out in a public space, is still better than not wearing one at all?
Absolutely, yes, I highly recommend that. If you have one of the N95 masks, I know they're hard to breathe in. Yes, I've had the experience on that too, but they are, it's definitely for your own protection. We've been very fortunate here in the state of Arkansas that we haven't had a really major outbreak. Now they have down in central Arkansas, but here in west and northwest Arkansas, it has not been quite as bad. We want to keep it that way. So anyway, yeah, you definitely need to be adhering to the guidelines like the governor said.
Ultimately, do you agree with the directives and the plans for the phased reopening from the state at this point? If you were part of that team making those decisions, do you feel like that has been made in a way that is helpful to everyone here in the state?
I really do, to tell you the truth. I respect what they have been doing. We cannot keep the economy completely closed, for any period of time. And I think we really are over the worst of this. The governor has given these statistics and has shown us that, if we do the social distancing and we, act like adults and do what we're supposed to be doing, we should be fine through this. Now, it does not mean that some people are not going to contract some of the disease. Obviously that is going to happen, but we want to try to blunt the effect as much as we can.
Sure. Well, we have more questions for you. We're going to take a short commercial break and we'll be right back. Back now with Dr. Stephen Carney with Baptist Health in Van Buren, taking questions about the COVID-19 pandemic. Doctor, let's start with this. Do you believe that other businesses should be following the same health guidelines that restaurants, gyms, salons, etc. are being forced to follow? Should everyone be wearing masks, social distancing, and even these businesses limiting capacity at stores and shops?
Yes, I really think that is for the best at this time, okay? It's like I said, we do need to do the social distancing. We need to be wearing the masks and, of course, doing the proper hand washing and hygiene and that sort of thing, too. That is going to help blunt the effect of the spread as much as we can.
The number of positive cases in Arkansas will start to go up again? Do you think we are past our peak and we will not re-peak?
Well, that's really hard to say, to tell you the truth. I really do believe that we are past our peak at this point. I do not anticipate that we're going to get another, surge as far as opening up the businesses and this sort of thing too. I really think that if we follow the guidelines that have been set forth, that we should be all right with this.
Do you think there's enough testing happening? And what limitations have you seen in terms of people being able to get tested even at this point?
Well, the testing is obviously is still kind of a sore point. There is we do have adequate supplies now, and we're getting it done in a much more timely fashion than we were when I talked, say, about a month or so ago. I do think we do, medical personnel such as myself and others should probably be tested for the coronavirus if we're going to be providing care or doing that sort of thing too. But there is still a limitation as far as the amount and the supply, but it is a lot better than it was.
Sure. Before we let you go this afternoon, I know you wanted to mention something about people having fears of coming into ERs or getting medical treatments, and what is your perspective on that?
Well, certainly that was something I wanted to address, because there's been a certain fear as far as people coming into the emergency room to get legitimate things taken care of. For instance, we had a woman here the other day who was having chest pains, came to drive up to the ER, and the nurses were trying to get her out of her vehicle, and she started yelling and saying, "Stay 6 feet away from me. I don't want to get the virus. I don't want to get the virus." Well, it turns out she was actually having a heart attack at that time, which is much more serious than having a coronavirus, okay? So it is certainly appropriate to use the emergency room for that sort of thing. Do not be afraid to come into the emergency room. We've had a loss of volume as far as our emergency room because of this, but we are there to take care of those sorts of things, and that is certainly appropriate. If you have any sort of questions, please give us a call here at the clinics or at the emergency room. Either one would be glad to answer any questions you have on that.
All right, Doctor, thank you so much for your time this afternoon. We'll be right back.